I pledge
Pledge
allegiance to the
the
flag of the United States
States
of America and to the
to the
republic
republic
for which it
for which it
stands,
stands,
one
one
nation,
nation,
under God,
under God,
indivisible,
indivisible,
with
with
liberty and
liberty and
justice
justice for all.
Thank you. So, on my minute.
Dr. Simmons, if I did share this link with Commissioner Myers. Maggie Myers is our new commissioner. She's a doctor and will most likely be joining this group on a regular basis. But she may
Wonderful.
be joining us a little bit later.
Okay, great. So she will be getting on, and when the Board of Commissioners does your reorganization, it's your belief that Dr. Myers will become the liaison from the Board of Commissioners to the Board of Health?
It seems to make the most sense, as much as I really enjoy it. It's very difficult for me to say yes to that, but yes, it makes the most sense. I think she's gonna, speak of the devil. Hi, Commissioner Myers is here. We were
I had
just
trouble getting in, sorry.
Oh, yeah, she's under your name. So Maura, could you repeat that name again? Sorry.
Oh, sure. Yes, I had sent her my link. So it's Maggie, Maggy Myers, Myers. Right,
Thank you.
Maggie?
Hello, Commissioner
Hello.
Myers. And which district are you?
I'm Ward 2.
Ward.
Two.
Ward. And
Yep,
what
you're my
does that
ward.
cover?
Yay!
What does Ward 2 cover? What part of the township?
Ward 2 essentially goes Upper Gulf Road down to Lancaster and King of Prussia over to County Line, but it also carves out Chamonix, that whole area. So I have the Fenimore Woods area as well.
So is Villanova within that ward? Is that
Part of Villanova is. I go to sort of this Spring Mill area.
great? Wonderful. Well, welcome aboard. Thanks for coming. So do I have a motion to
Dr. Simmons, just
yes.
real quick, just point of order, sir. If we could do the reorg first before
Yeah,
official
yeah.
board action.
You have to do
I
that
know
first,
the
yeah.
agenda. I
Absolutely.
didn't see that
So-
until it just came across my desk.
So having announced, having announced that we would have election of officers, hi, Joan.
Hi.
At today's meeting, and nobody having submitted either a nomination of themselves or anybody else, as of right now, the slate of candidates is the retention of the current chairman, myself, and the current vice chairman, Kathy. Is there anybody who wishes to put themselves forward at this point? And if not, can we have a vote? I guess we could do it by show of hands. If we put our hands in front of our faces to reelect the chairman and vice chairman at this time.
Dr. Simmons, maybe better do a roll call vote for that, just to keep it official.
Sure.
because of
Okay.
Zoom.
Okay, so I'm gonna go ahead and vote for myself and for Kathy. Kathy,
I vote for myself and Dr. David Simmons.
Bob,
I vote for David and Kathy.
thank you. Lisa
I vote for David and Kathy.
and Joan, please.
I vote for David and Kathy.
Thank you, Kevin. So that's let's see, 1, 2, 3, 4, 5 of us. The two remaining, Julie will not be in and Alex will be in shortly, but I don't know whether you call that unanimous or not in the absence of two of the members, but let the minutes reflect that we have voted to retain current leadership. And then Maura was pointing out, Joan, just before you got here, that Dr. Maggie Myers, who is Ward 2 Commissioner, is in all likelihood, when the Board of Commissioners does their reorganization, going to move into the role that Maura has taken as the liaison from Board of Commissioners to Board of Health. So that, I think, is it for organizationals. So we do need to, did anybody or everybody have a chance to see the minutes? Are there any corrections for the minutes? Any comments, concerns, additions, deletions? And if not, can I get a motion to approve the minutes and codify them?
Motion to approve the minutes.
A second?
A second.
All in favor?
Aye.
All right, so
Aye.
let it be shown that the minutes are reviewed and approved. And then the one last organizational issue I did put on the agenda was back to you, Maura, to see if there is anything that has happened at the Board of Commissioner level since our last meeting related to the establishment of the County Department of Health and the transfer of previously township-driven services to the county, and anything that has come up that might reflect back to things that the Board of Health may need to take on, the Township Board of Health may need to take on as we make this transition. Is there anything there we need to know?
So I'm going to defer to Kevin, who probably has more current information than I do about the Board of Health. I imagine you're also talking about, we're using a third party for inspections right now. And we'll continue to do that until the county inspectors are in place. Kevin, is there anything you could add?
Nothing substantial, Commissioner. As Marie indicated last month, they were anticipating mid-January getting their approval from the state of the plan that the county submitted to become an operational Board of Health. That has not come through yet, but as we are now in mid-January, we would anticipate any day now getting the word that things are going to be transitioning, at least in part, the environmental side of things that Marie was talking about to the county, but we have not heard anything definite as to a date certain at this point. So we're going just off of what Marie's update was last month.
So has anything else percolated to the surface, either at the level of the full-time employees or at the level of the Board of Commissioners, related to functions that we will need to backfill? Are there any gaps? Is there anything else that's going to go on that we need to be aware of as this transition occurs, or is it pretty much the environmental piece transitioning over to the county?
Well, the environmental piece is transitioning over, so pool inspections, food establishment inspections, the licensing of those as well, the review and approval of those will all be done down at the county. There's are going to be some probably overlap where we deal with hoarding issues and just things of the personal care nature that, well, maybe a function of that. We're probably going to be the first call on those just because residents are used to calling the township on those. But it'll be a collaborative effort as we've done in the past with county agencies, just now with the new county boards and the departments down there. So, but the restaurant, primarily it's going to be the restaurant licensing, review and inspections, as well as the pools.
Is there any reason to anticipate that there are areas where, as the new county department ramps up, new commissioner, it seems there's some heterogeneity among the townships around their enthusiasm for just the environmental piece, let's say, but are there going to be other things, services offered, demands on the townships for supporting services, or is this pretty much going to be plug and play?
The way it was indicated to us was kind of plug and play. Once the county gets the green light from the state that they're legally obligated to perform those functions, and township has to take a back seat to those. You know, if there's a need to assist and collaborate to the effort that we can and have the abilities to, we absolutely will do that in the interest of our residents.
Great. Anybody else have any questions on that?
I have a
topic?
question about restaurant inspections. It seems like that's a huge function and is better done with, you know, very local knowledge of the restaurants. Do you think that's going to be compromised at all if it's moved to the county versus the locality where there's more familiarity, I guess?
Yeah, unfortunately, you know, when these things happen, yeah, I think when you have local resources that are right in the municipality, can handle those probably a little bit quicker fashion. I think Radnor is very fortunate to have Marie heading up that department. She's very familiar with Radnor and the restaurant.
Right.
So, you know, I think
But
that
she'll
that's
still continue to be in charge of that for our township then?
well, she's in charge of that for the entire county. So
Yeah.
whether she's going to be getting into the field or not, you know, I don't know how they have their organizational chart and what roles and responsibilities for the individual staff. We have assisted them and provided some training to the new employees coming into the county on plan review and They've done a tour of in fact, I think it was right around our last Board of Health meeting, of some of the Radnor facilities with Radnor staff. So we did spend some time going over and assisting them with that. And, as the need arises to do that in the future, we would absolutely, jump on board to help the county out. It's in our best interest to make sure that they're up and running with the tools and resources and the knowledge. And if we can help assist in that. But unfortunately, I think the state has taken that away from our ability to regulate any kind of local enforcement. Once the county gets rolling, that ship has sailed. It's at the county level.
So we actually have a leg up in that our service that will be rendered by the county that was formerly rendered by the township is going to be rendered by, or at least led by, the officer who had local knowledge.
Yeah.
So that
Correct.
by the time we get to strangers, should that happen, there will at least have been a transition period where the local wrinkles will be understood at the county level, and the history of township inspections will be past history. So we're fortunate in that regard.
Yeah, and I think it's important to note that whenever you have these types of transitions, there's always going to be a few wrinkles. And again, we will do our best to help smooth those, whether it's knowledge transfer or assisting with paperwork, whatever we can do to assist that, because ultimately there are businesses that are in Radnor served primarily by in servicing Radnor residents. So we want to make sure that if there's anything that we can do to assist that we will absolutely do that, because ultimately it's in our best interest for our residents.
Great. So while we're on that topic, and the next item being the health officer's report, I think that we've kind of been working right in that wheelhouse. So why don't we let you go ahead and continue, Kevin, with the health officer's report?
Absolutely. And I apologize, Board, for getting this out. It's been a crazy month going through December with the holidays. I did come down with COVID myself, so I was down in commission for a bit.
I'm sorry.
So this was kind of a little bit of a scramble pulling everything together. For December, again, we are still utilizing the services of our third-party consultant, Barry Isett. We're served by a health inspector, Ron Rex, and a health officer, Anita Einoff. Both are, as I mentioned back in December, Anita had COVID and she was out of action for 3 weeks. She has recovered and is now back to assisting Ron on a more regular basis. But we have them 1 day a week servicing the inspections. We are all caught up on our inspections and now just performing the routine annual inspections moving forward until, again, the county says that they're taking things over. But for December, we conducted 11 inspections, restaurant food establishment inspections. For that, there were no special events that occurred in December. November, if you recall, we had a food truck event over at Agnes Irwin. And I think in October, we had a mobile food event for one of the local elementary schools. But we did assist Radnor Township Police Department on 2 animal incidents. A dog on dog bite, and then a dog on dog and human bite as well. So we're working with the police department to make sure that all the animals have their necessary shots and are following all the quarantine protocols and whatnot. But that's a collaborative effort as usual with our police department. That wraps up the health report for December.
Any questions?
Nope.
Excellent. That takes us to old business. Hopefully Alex will be joining us shortly. So let's drop that agenda item to the bottom of the old business. Joan and Maura, any relevant to the things are seamlessly falling together, relevant to the last part of the health officer's report, an update on the animal health ordinance project?
Yeah, so Joan, you probably know as much as I do. You may have even had more conversations, so I'll let you take this.
Yeah, well, I met with Bill Gallagher to go over some of the wording and some of the content and the wording on a few things. And we have another meeting scheduled for Monday to kind of tighten it up. And then we'll, I guess the next step would be that it goes to the Board of Commissioners.
Right. So once, I think once Officer Gallagher is sort of satisfied with your meetings, it will go back to our solicitor to make sure that it's in the proper form. And we can present it to the we can introduce it to the Board of Commissioners at that point. So I would imagine, maybe the second meeting in February, if we're maybe the first, we have a meeting on the 24th. It won't be of January, so it won't be ready by then, but I would imagine the February meetings.
So then he would be presenting it to the Board of Commissioners, is that correct?
So most likely it will be presented by a department head. So Chief Flanagan might chime in. John Rice is our solicitor. I'd imagine he would lead us in to describe what the changes are and, sort of the legislative piece of it. And then I can speak to it. It would be something, if you'd like to speak to it, you could speak at public comment. So we can decide as we get closer how we best want to present it. But I can do that in partnership with you and make sure that, our department heads and our solicitor are prepared.
Great.
So for me to summarize, for you guys are, once again, I want to thank both Joan and Mara for carrying the heavy weight. And I think the township will have much benefit that will predominantly exist in the background, but the benefit is substantial. So thanks to both of you guys for doing that. And I want to ask, is there any support from the rest of the board that you will need to get this to its successful conclusion, or are we cruising?
I think probably once we get the language tightened up, I would like to present it to this group for another review. Whether that is, I don't think it's a voting item, so we might be able to do it offline. I'd leave that to you, Dr. Simmons, to decide. But I think, you should all have your eyes on it before we present it. And I'd welcome your feedback before we take it to the board.
I think what you said is the way to go then, rather than waiting through meeting cycles. When it's ready, send it out to the membership of this board with a reasonable time period for review and submission of comments, and get it done offline and keep the thing moving as well as we can. I think, Kevin, any reason not to proceed that way in your mind?
I think that's a good way to proceed. And if we need, additional staff resources at ultimately the Board of Commissioners meeting, that we can make arrangements to have them there, it's generally not a problem. Working that if Officer Gallagher needs to be there, we'll leave that up to Commissioner, you, Dr. Simmons, and Chief Flanagan and myself, and we can make those arrangements.
Excellent. Great. So next agenda item is the
I had one more thing.
sure.
So during our meeting, we're also going to be discussing some, Bill and I, some of the dog park, some dog park changes, because the police department is dealing with a lot of these things. You had mentioned the dog on dog bites, dog on people bites, things like that. So how we can make it safer and have fewer incidents.
So let me fully understand. That's great. It sounds like a related but not completely overlapping.
Yeah.
Sounds like once you learn how to take out the garbage, you get to take out the garbage kind of thing for you, Joan. But I'm thrilled that you're taking that on. That's great. So you'll keep us surprised, and we'll keep this as an open follow-up agenda item. Yeah. Okay, great. So it's back to you on the for an update on the road safety writ large. I don't know that that's the best. It's a larger rubric than just road safety. We're talking about human health, animal health, and the environment in the township for our domestic wild and human animals. Is there any update for us on that, John?
Well, yeah, thus far I've dropped the ball, and I have not gotten together the list of roads that we would propose for this signage. And so that's the next step, and I'm working on it.
Great. And so the proposals for signage changes, is that the main current effort in this regard? Is
Yeah.
there any, are there
Yeah.
any other,
Yeah. But locations, road locations is obviously a big part of that. So, so that's the next piece of information that, that they're waiting on, Officer Steinson and
right,
Chief Flanagan.
and
John, is
now-
there,
go ahead.
no, I was just gonna ask, are the police or public works crews able to provide you with information around where they typically encounter animals on the road? That data that would be helpful when deciding.
And I'm gonna talk to Bill about that as
Okay.
well, but
I'd imagine that they've got some, some
they do have
documentation.
data on it. Most of the deer hits are on Bryn Mawr Avenue,
Right.
is my understanding.
Okay.
And that Bryn Mawr Avenue also already does have some signage.
Great. So we also have your new dog parks project going on. I think again, we touch back on this and see if there are other ways in which we can impact our environment in a positive way and keep this going.
Mhm.
So the November public participation, I have as yet not gotten to sit down with Mr. White and have a discussion about what those concerns were, reminding people that public participation, there was some concern raised about efforts that had previously been made available for elderly folks for mitigating the effects of extreme high heat that were not continued through the first epidemic summer, and there was concern and a request there, and I will talk to Mr. White before we start to get warmer weather. So that brings us around. So we'll leave that as a follow-up
Okay.
to the school board relations, and I was hoping to vamp a little bit enough to get Alex on board, and Alex should be here shortly. So we need to make a decision. The next agenda item is also involves Alex, and that's the student interns. We can either turn that over to you, Maura, or we can go to the student interns and then come back to that.
No, I think
I'd
I'd be
say aware,
happy,
Dave.
I'd be
sorry.
happy to do the relationship with the school. I've had some conversations, but Lisa, do you want to say something first?
No, you go ahead, then we can do the interns. That's
Oh,
fine.
okay, great. Yeah, I mean, I think I can cover this. I'm sure Alex has more to add, but the letter has been shared with me and with Township Manager William White. I think it's in a good I think it's the right letter. I've had conversations with the new school board president, Amy Goldman, about procedure. So in order to memorialize what we are asking, why we're asking, I think that it was done quite well through that letter that everybody contributed to. The process now is that I'm going to raise it at our meeting, the Board of Commissioners, on next Monday night, to get a sense of the board, whether or not the proposal from the Board of Health will come to the Board of Commissioners to decide whether to move it to a request to the school board, which I don't have any reason to believe that commissioners won't want to do so. They've heard about this issue before, so they'll be ready to hear about it. Once that's done, it's not a real vote, but it's going to allow us to then move forward formally with the school board.
Excellent. So again, this is slow and cumbersome, not hard to understand when you have a school superintendent, a school board, a board of commissioners, and a board of health all trying to kind of dance around the same flagpole.
That's right.
It takes step-by-step process, but hopefully by sometime this spring, we will have well cemented relationships between school board, board of health, board of commissioners, so that the board of health can efficiently serve the needs of the township in those relationships. So great, thank you.
And just, I'm not getting any pushback from Amy Goldman, but she
Right.
obviously needs to present this to the superintendent and the rest of the board. So
Mhm.
I have a good feeling about it, but sort of just going through the motions of it.
Well,
Um,
we're asking to dedicate a resource on their part. And I think it's, we want to make sure it's the right resource for bi-directional communication, and B, that on the other side, that they have a commitment to making that work. So great. Any other comments on that? All righty.
Nope.
So then hopefully Alex gets here shortly, but Lisa, do you want to start in on Lisa? It's your
Sure.
floor.
All right, so the students basically worked on kind of like a research proposal, kind of getting together what their plan is with a timeline, which is great because I think it definitely sounds reasonable for getting it done in the time that they wanted. So I wanted to give them just a quick opportunity to kind of just say what the different parts that they're going to be working on, and you know, without giving too much info, because we'll hear from them a lot in May. So I'm not sure, Anna or Hygiene, who wants to go?
I think Hygiene wrote a lot about like the introduction part of the project, so I think I'll let him first explain that.
Okay.
June, could you adjust your camera so we can see more than the top of your head, please? Thank you.
Okay.
There you go.
Yes, my thing went dead.
Let me just first. Yeah. Okay, so like what we're going to like do is all about like the effect of recent excessive headphone use on hearing for teenager in Radnor. And like for the background information, since like I mean because of the COVID-19 and like we kind of turn like whole classes and like whole activities by Zoom or like Google Conference. Like I mean we are like lot exposed to the like electric device, and it's especially for the headphone because to hear the like the classes. So like but I mean like this headphone, I mean when you expose this headphone like really long time, like it is not very healthy. According to Harvard Health Publishing, when I saw it, also the like this like long time use of headphone is like that only cause like the hearing problem, but also it causes like some disease that revolves around the ear, which is and like one example is otitis externa. Yeah. And like that was my background information, and like our aim was like to estimate the time of headphone or earphone usage among the students in RHS, and like to understand any symptoms specific to the long-term uses of headphones or earphone, and to estimate any difference in symptoms between different type of earphone. And Anna will talk about the methodology and the timetable.
All right, so in terms of the methodology of our project, we basically divided our research into three main components, the first of which being to conduct in-depth literature research on the topic, where we aim to answer a couple of questions, including what is the maximum decibel level that most headphones go up to? What are the most common headphones that teens use? Have these headphones been linked to impaired hearing? How long does it take for headphones constantly used at the highest volume to start impacting hearing? Do headphones used at a low or moderate volume still have adverse effects? How do prolonged or loud sounds impair hearing on a biological or cellular level, where we plan to explain sensorineural hearing loss? And then how has virtual learning due to the pandemic affected the nationwide use of headphones, and what preventative measures can be taken to protect teens' hearing? So the second part of our research is going to be focused on gathering data and information from school records, where we plan to inquire about how technology trainings during the pandemic have taught teachers how to make recorded lectures, and if these lectures will continue to be used in the future. And we'll also look into how many headphones were recently purchased due to the sudden increase in teachers giving students recorded lectures and videos for assignments. And then the last part is to conduct a small survey where we plan to gather a group of 10 or so RHS students and ask them to track the total number of hours they use headphones in a week, as well as to track which volume level they use. And we'll also note which headphones they use. And then we'll determine, based on our literature research, if the amplitude and duration of the headphones of the sounds in their headphones could be potentially harmful to them. So in terms of a timetable, in January and February, we plan to conduct the in-depth literature research. In March, we plan to gather data and information from school records. In April, we want to conduct the small survey, and in May, we plan to collect all our research and findings and create our presentation for the board.
Wow.
Nice.
I'm planning to touch base with the school. I'm anticipating not a big problem because they can kind of self-select, which obviously limits the research if they're self-selecting people they know, as students, but that way we just make it so it's not, randomly selected from student population, because I think then we'd have to get a lot more permissions. But as long as that's taken into account in interpretation of the data, I feel like that would be reasonable as far as not being a randomized group of students.
Right.
Well, it's an exploratory.
It's a
Correct.
fact-finding
I
mission.
don't think
Yeah,
that
yeah.
you're going to have a big enough sample size to extrapolate, but it's a phase 1 trial, shall we say?
Right.
Yeah, you guys are biting off a whole heck of a lot, and I'm incredibly impressed. Hello, Alex. By the way, welcome. Thanks for joining. So what support do you need from the rest of the board at this point to continue in your endeavors? I'll take silence as none. I would explore what it's going to look like, the actual. So we did agree that we wouldn't do any large polling. It's a kind of a small poll, but I think it's a completely reasonable thing, and I would just explore get the as many as you can without making it cumbersome, and figure out what you do have in terms of what inferences you can make, what rather implications you can draw from the data that you generate. But it sounds excellent to me. Anybody else have any comments?
Nope.
Great, thanks, guys. So just for a moment before we go on, and let me cue you up, Bob. You'll be your presentation next, but Alex is back in, and just Alex Morrow gave us the follow-up on the school board, and we did re-elect our officers, and the face that you might not recognize on the tiles is Dr. Maggie Myers, who is the Ward 2 commissioner, who, if all goes as expected, Maura has introduced as our likely next liaison from the Board of Commissioners to the Board of Health. So I think that catches you up, and anything that you want to say before I turn it over to Bob? All right then. Bob, you're up.
Okay. Let's see if I could share my screen here.
I guess while you're doing that, let me just introduce, we had in the fall, we had agreed that some presentations from the newer members in their areas of expertise would be in order, and Bob was kind enough to delay from his original December appointment to to today. And now that you've got it up, I'll turn it back over to you, Bob.
Okay, so could everyone see the title screen?
Yes, sir.
So what we're going to do
Yep.
is we're going to talk about how the pandemic has affected the oral health of our general population, including children, adolescents, and adults. So I'm just going to go through a couple things here. So at the start of the pandemic, let's get rid of this here. At the start of the pandemic, around March 6th, the first documented case, at least that I could find in Pennsylvania, was actually in Delaware County. And in March 30th of 2021, there were 1,736,920 cases of COVID in Pennsylvania. And you can see the two lines here, the confirmed cases and the deaths. And this was just the phase 1 of the pandemic. And then the next slide will go into a little bit more detail. But there was an exponential increase in the COVID positive cases in the United States over the first month of the pandemic, reaching over 1 million confirmed COVID positive cases with just under 10,000 confirmed deaths from COVID. So this is just a little history from 2020. And then cases in Delaware County, we're seeing a similar exponential increase in new COVID cases that we saw in the beginning of the pandemic. And this is going from November 10th of this year to basically today. And if you look at the blue dots, these are the new cases in Delaware County. So we reached a peak somewhere around the first week of January, and now it seems like we're on a little bit of a decline. 1 in 6 people in Delaware County have tested positive, and totally to date we have 1,631 deaths in the county, and 98,000 positive COVID-19 cases. So this was in the news last week, and over the last couple of weeks, we all know that the mainline health hospitals were closing to elective cases. Springfield Hospital in Delaware County closed the ER. They weren't accepting any new patients due to the rapid increase in the new Omicron strain of the disease. Almost 40% of current hospitalized patients are suffering from COVID-19. Here at Jefferson, the numbers have been increasing. They're sort of stabilizing at this point, but that current 40% is about anywhere between 33 and 40% of inpatients have COVID-19. So what happened to dentistry during the pandemic? So on March 16th of 2020, the American Dental Association asked that dentists nationwide only see emergency dental care until April 30th, 2020. And emergency dental care was specifically pain, swelling, infection, broken teeth, and crown. In Pennsylvania, all dental offices were closed, except for those that had negative pressure in their exam rooms, which really left only the university centers to be open. So there was a significant, there was nowhere for people to go to have their dental treatment during these couple of months. There were 3 out of 4 dental practices were seeing emergency patients almost, and almost a quarter closed their doors altogether. So this was really a problem during that time period, especially that Pennsylvania mandated negative pressure only. In March 25th, all U.S. public school buildings were closed, and nearly 1/2 of students relied on free or reduced price school meals. 55 million students were affected and forced to transition to online learning. This was essential, especially with those kids that live in a food desert where there is some scarcity of healthy foods. Families were forced to buy cheaper, unhealthy processed foods that were significant in salt, fat, and added sugars, which we'll talk about in a minute, which led to a lot of dental issues. So many of the school-based programs, since the schools were closed, the school-based programs were closed. And interestingly enough, I called Radnor Middle School and spoke to one of the nurses, and Radnor Township doesn't have an oral health school-based program. So this is something that once we're out of the pandemic, we might, as a Board of Health, want to consider. So many schools have a dental sealant program, and of course they were closed. Chester County has a dental sealant program, and they applied over 2,200 sealants for over 350 students in a year. And often these preventative oral health care services that the schools provide save a lot of teeth, especially in vulnerable populations. And the closure of these these school-based programs attributed to about a 20% decrease. Well, the school-based programs attribute about 20% decrease in caries among K through 12. So these school-based programs actually do work. So it's something to consider in the future for Radnor. So let's talk a little bit about dietary changes. So there was a cross-sectional study in France during the time of the pandemic, which saw a 36% increase in snacking among kids 3 through 12, with more than 50% of parents saying that their kids are more bored than before the pandemic. And this is important because when you have sugary foods or drinks many times a day, or sip the same sugary drink for a long period of time, acid attacks the enamel again and again, not allowing time for remineralization to occur on the enamel. So parents reported that an increase in snack frequency in between meals, about 36% of children. And there was a 4 to 20% increase in dental alveolar trauma during this time period, because the kids really had nothing to do. They were trying to do school-based programs, and they just basically got into trouble and fell or whatever. And there was an increase in dental alveolar trauma in these pediatric patients. There was also an article from the British Dental Journal that saw anywhere from 4 to 20% increase in dental alveolar injuries that we just talked about. So let's talk about the feeding practices. So there was an 18% increase in soothing foods, and soothing foods are really defined as sugar and fermentable higher in sugar and fermentable carbohydrates. And there was 22% decrease in parental guided choices for snacks, 31% decrease in set feeding schedules. So all of these things put together came up with about a 25% increase in caries seen in the pediatric population during the COVID-19 pandemic. So the parents were basically feeding their kids, high sugary foods, so that they would basically be quiet and have, not be in their way, basically. There was another study coming out of France that showed that when parents are shopping, they're looking for more pleasurable and sustainable foods, such as ice cream, ramen, and canned goods. Interestingly, the greatest decrease in motivation was observed for buying convenient foods. This includes pre-made dinners like rotisserie chicken, salad bars at grocery stores, which may be related to the idea of sterility, as other people would be in close contact to those foods. So if you look at this chart, 85% of parents reported at least one change in their motivations to buy and prepare certain foods for their children during the lockdown. And the greatest increases in motivation were buying pleasurable and sustainable foods. And of course, the pleasurable and sustainable foods are the ones with the high sugar content. So if you look at the chart under health control on the top right, and you see the plus sign, so there was really no difference if you look at the equal sign in the pandemic of whether they're concerned with healthy foods. But if you look at the sustainable foods, if you go over a couple, you see there was a much higher increase of buying sustainable foods and pleasurable foods than healthy foods. So we also have to look at parental eating and cooking behaviors and how this affects the children. So about 45% of parents reported consuming more foods during the pandemic. And 72% of the parents report spending more time cooking for their kids. Unfortunately, the cooking is really based on comforting foods or recipes that contain more sugar and higher percentage of carbohydrates. And if we look at this chart, you see that about 45% increased food consumption that we talked about. And about 72% the parents spent more time cooking. And then this is the kicker, is 57% of the cooking was done with more pleasurable and comforting foods. So what are some of the beneficial foods for oral health? So vegetables and fruits stimulate saliva. Saliva contains traces of calcium and phosphate that remineralizes enamel. And this is protective against early onset of gum disease. Milk, plain yogurt, and dairy products have an abundant source of calcium and phosphate, and they contain a mineral called casein. And casein is an anti-karyogenic phosphoprotein, and it's contained in milk and cheese, and it binds in the saliva with hydroxyapatite to prevent the adhesion of bacteria on the tooth. With regard to whole grains, vitamin B and iron keeps gums healthy, and magnesium is an important ingredient in keeping bones and teeth strong. So what was happening during the pandemic was parents were buying less of the good foods, the vegetables and fruit, the whole grains, and getting more pleasurable foods. So this is a kind of an interesting little graph here. So home confinement in the pediatric population. So if you looked at increased home confinement, it's associated with more anxiety among preschool children, which leads to stress-induced alteration in sleep. So what do the parents do? They increase parental administration of fermentable sugars to help the children sleep. And then this in turn leads to increased risk of early childhood cavities, or ECC. There's a product called silver diamine fluoride, and this is FDA approved topical solution that prevents caries and reduces tooth sensitivity. It's a great alternative to conventional composite fillings we saw an increase in use of this during the pandemic because it's not aerosol generating and there's no anesthesia involved. So basically, if you look at the photo on the top left, this is an area of caries, if you see on the central incisor, and then it's painted with this silver diamine fluoride. Unfortunately, it turns the caries area black or dark brown, but it does help prevent it from spreading. And there's two components. There's the silver component, which is antimicrobial, and the fluoride, which allows remineralization. So this was highly used during the pandemic by many dentists because, like I said, it's non-aerosolizing and it didn't require anesthesia. Another area that to consider is oral hygiene among parents. So the parents themselves should maintain good oral health because it's essential to the risk of transmission of bacteria. So increased mother and father to child transmission and karyogenic bacteria, especially in the age groups 3 to 5, can induce early childhood caries. Actions such as kissing can transmit bacteria to the children. So that's why it's really important for the parents to keep their own oral hygiene in check so that they don't transmit these bad bacteria to the children. So the association between oral health and COVID-19. So everybody knows in the literature that poor oral hygiene, gingivitis, and periodontitis can lead to or are linked to chronic diseases such as lung disease, diabetes, and heart disease. So if you have poor oral hygiene and you have patients with these chronic diseases, they are certainly at an increased risk for severe COVID-19 symptoms. Furthermore, the oral cavity is a significant reservoir for respiratory pathogens, including chlamydia and pneumonia. And patients with periodontal disease are more likely to develop hospital-acquired pneumonia as a complication. So it's important to improve the oral health during the pandemic, especially for those with chronic diseases. So teledentistry, just like telemedicine, came into vogue basically during the pandemic. And this was to basically triage care. And the dentists were able to determine urgency of the dental need. So basically, you really can't do an oral exam during a teledentistry visit, but you can talk to the patient and see what the chief complaint is and to help prepare yourself for that dental visit. And also increases access to care to those in rural areas, as well as those with decreased access to transportation. So moving forward, what does this mean to us? So one thing I think we should definitely look into increasing the oral health education in the Radnor Township School District, whether it's in the grammar school, the middle school, or the high school. So oral health education is extremely important. Possibly develop an effective oral dental sealant program in the township. The nurse that I did speak to said that they would love to have a hygienist on staff that could help with the oral health initiative. And the other thing would be to improve the education of eating appropriate foods that are beneficial to maintaining oral health. And that's my presentation. Anybody have any questions?
Thank
Great
you.
information. Thank you.
That was great.
I'm going to do my walk of shame because all that applied to me. So I'll be the first one.
Have you
So-
seen patients, getting back to their normal, regularly scheduled appointments? Because I know talking to my patients in the office, some of them are like, yeah, I gotta have that on my list. I still need to see the dentist or, the eye doctor. So I don't know if you guys saw a big drop off still currently, or if things are back to normal.
No, things are pretty much back to normal at this point, especially in the oral surgery world. In the dental world in Philadelphia, most of the general dentists are probably seeing 80 to 90% of their regular routine patients. With this last surge of Omicron, we did have a lot of cancellations, not because patients wanted to cancel, but because they were positive. So we didn't allow them to come into the office. But things are pretty much back to normal. Everyone, of course, we as healthcare practitioners in oral surgery and in dentistry are extremely at risk because we're in people's mouths and the transmission. So everybody wears N95s and the proper PPE in order not to become infected with COVID-19.
So from a board, first, thank you very much. It was an illuminating and nice, tight presentation with lots of great information. So thank you for the effort and for bringing that to us. The last slide, it seemed to me there are two separate actions moving forward. One would be to work with the school board, hopefully with a new liaison, to consider encouraging the school board to get into a preventive program you call a dental sealant program for the township, and the other maybe multi-armed and multi-purpose, and that is oral health education. And can we undertake to make information available to the citizens of the township that will in general help them to make better choices to improve oral health? Is that a good summary?
Yeah, that's excellent. So one of the things that I do pre-pandemic was being involved in Operation Smile. I don't know if everyone's familiar with Operation Smile, but I've spent 10 consecutive years going to Southeast Asia and basically trying to teach oral health to the children, to the elementary school children in Southeast Asia. So we have some great programs with great puppets and things that we can use in Radnor as well. It doesn't have to be Southeast Asia, it doesn't have to be Vietnam. It's just learning tools, and make it fun for kids to learn how to floss and brush and do all the things that are healthy for them.
Great. Anybody else have questions? So in the category of no good deed goes unpunished, that puts you in the position of getting an agenda item for next month's meeting for follow up.
Right.
Thanks an awful lot, Bob.
Sure.
I also it was interesting to me, one of your first slides, the putting together the data, the 98,800 cases to date and 1,631 deaths to date, suggests they quickly computed about a 17% case fatality rate, which is it is not a good figure, but it does represent over the entire course, amortized over some really high mortality periods and some lower mortality periods, that this has been a real serious and potentially fatal disorder. And I use that to lead into the next agenda item, which is the COVID and flu updates. And I'm sure that if you were to do it for the Jefferson system, or somebody were to do it for the Penn system, or Mainline Health sent out a letter. I was on the distribution list, and I'm not sure how I got on it, but we are currently in a very dynamic period. 2 years from the first reported case in the United States, so 2 years into the pandemic into the United States. The cases are at an all-time high, although in the last week, as you have pointed out, that peak seems to have fallen off. But other implications, and Bobby went over a lot of the kind of things that are downstream consequences, not necessarily primarily of having the disease, but of what the impact of the pandemic has been. So we have stressed healthcare systems with people that have dropped out of the healthcare system, and people are ill in the healthcare system. Flu, we haven't even talked about flu. Flu is raging. There is a lot of flu out there, and there's a lot of pent-up demand for healthcare. So our ERs and our hospitals, despite the fact that the Omicron variant may be the attenuating strain that leads us out of the pandemic and into an endemic situation, even if you have 1/5 the severe illness and 1/10 of the fatality rate, if you have 10 times as many cases or 20 times as many cases, you are still going to be putting a stress on your healthcare system, and that is apparent. Alex brought this up a couple of weeks ago, and Alex went back and I went back and forth basically on a when is good enough, and when do you pursue for perfect. But we did talk about that, and I put together a document that I would like to send to Mara as the chairman of the Board of Commissioners, to Mr. White and to Chief Flanagan, in terms of the township supporting undertaking mitigation to decrease spread of the Omicron variant for the period of time that this remains a problem, and until things settle down in the healthcare system, to avoid adding to the burden to the healthcare system. I'd like to send it out ASAP, because if we wait too long, we won't need it. But so what I'd like to do is ask everybody to have a look, and any specific feedback that you wish to offer, I'd like you to get it to me by, say, middle of the day tomorrow, by noon tomorrow. And if I have assent from the board and nobody who believes that we should not take such an action, the only thing I would like to discuss here now is if there is anybody who believes that we shouldn't do such, in which case we should have that discussion with the board in general. But otherwise, I'll be happy to take any comments and incorporate it into the basis that I laid out and get that going tomorrow. So I open it to the floor for comments, concerns, criticisms.
David, the only thing I saw is your mask, and I can't remember your wording. You had specifically called out 95s. I thought surgicals were also on that list, CDC approved, not the cloths were taken off.
Yeah, my opinion on this is that when you look at the studies for the value of mass prevention, the number one quality of mass prevention is if everybody wears them and they fit well, is number one. Now, Omicron has changed that some because it is more of an aerosolized and less of a droplet spread. And I have reviewed everything that I can find, and single layer cloth masks were never any good. They didn't become less good. The balaclavas were never any good. A properly fitting 3-layer tight woven cloth mask actually has demonstrable value, although we don't really know in Omicron. So at the end of the day, rather than recommending specific masks, I think that we should do two things. We should recommend wearing masks and try to move the community in the direction of those masks that are clearly demonstrable as providing protection in the high-risk situations, because we know N95 and KN95s appropriately constructed have been demonstrated to provide substantial protection in high-risk situations like ERs and hospital floors. But at the same time, if somebody doesn't have a KN95 or an N95 and isn't going to get one, my opinion is that if they put on a properly fitting or double mask, now right now there's a campaign against the double masking because people are not putting them on right. They're disrupting one protection with another. If you put them on right, so to me, that's also going to be true if your KN95 is a chin bra and not a face cover. It's not working. And by the way, there's a huge problem with counterfeit masks in the N95 and KN95, and it's nearly impossible. Nearly impossible. I've tried for 2 days to sort that out. So I think we should not really become arbiters of new standards. We should go with the CDC standards, and we should push people in the direction of the CDC standards, and not let perfect be the enemy of good. That's how I
right. I just thought you called out that one. I don't have the wording in front of me. Did you just say CDC suggested, or
I said mask
requirements? CDC is a
signage,
guidance. How did you word that?
Mask requirements and signage should be upgraded to reflect the most current CDC guidelines, emphasizing the superiority of N95 and KN95 over surgical and cloth. And I'll modify that. I'll go back.
I think the surgical was also recommended. Yeah.
They were recommended, but if you look at the data, the surgical are nowhere near as good as the N95s.
Right, but you're referencing a certain CDC recommendation. Right.
So I will do that first thing in the morning. I will go back. I will specifically. I will align my recommendation, the verbiage of my recommendation with CDC. Maura had also pointed out that in my preamble, I had mentioned it does appear that the COVID syndromes associated. I'm going to modify that just a little bit because it was confusing. I use syndrome as in jargon. The clinical diseases, which are really syndromes, not diseases, but the set of clinical syndromes that we're seeing with Omicron does appear to be somewhat different from what we had seen with Delta. That's A. B, I'm not sure we're completely done with Delta. I think some of the people still in hospital reflect Delta disease as opposed to Omicron disease, but I will tighten up that piece. Any other comments at this point? And if you don't have to, if you have other comments, please get them to me by noon tomorrow. But I'll make those corrections and I'll work with Kevin to get it appropriately sent out with appropriate logging of it so that it's an official document.
I just have a question. What is the current policy for township employees when they're in the building as far as masks?
Right now, we are kind of partial manned with the suggestion to kind of go down where possible to 50% manning. And that's, I think, through this Friday, and administration's gonna take a look at that. It is recommended to wear a mask. If you are suspected of being in close contact or test positive, we follow the CDC guidelines for isolation and quarantining.
So it's currently recommended, masks are recommended, but not required amongst employees.
Correct.
So then my only suggestion would be that whatever goes for the public coming into the building should also go for the employees, everybody in the building.
Yep, everybody in the building should have.
Yeah, and that's a great point.
And I can pull up the memo to make sure I clarify on that, because it's been a couple weeks. So let me just double check that real quick.
Right. So the reason I constructed the letter the way it is that the state at this point has decided to emphasize vaccination and to not go back to mandating mitigation behaviors. And the county is not up and running yet. So we are in an advisory role. We don't have a true legal role. And I did not want to put anybody in the position of either being in a bind at the state or the county level. So I wanted to give as much leeway to the staff and to the board to do as much as we possibly can without putting them in a difficult situation. So that's why I did not, I was not proscriptive or prescriptive, but rather emphasizing that we would encourage as much as we can do as a township to mitigate for these hopefully few weeks until we get into the warm weather and the complete takeover of Omicron and a more endemic phase. So that's why I did it that way.
I just pulled up the memo that went out to staff wearing a mask. So it's recommended that all employees, visitors, and customers wear a CDC recommended mask while inside the township building.
Excellent.
In my experience being in the building, everybody's masked if they're not closed in their office.
Good.
I do think that your recommendation of upgrading to surgical or N95, KN95 would be a positive move at this time.
And we're also encouraging a lot of use of technologies for meetings. So where possible, conduct meetings remotely with contractors and residents. Obviously, when we have building inspections and things like that, or with our police department, and they have interactions. Some of those things are required to be in person, but to the extent possible and feasible, we are pushing things to a virtual meeting environment.
Silly question. I should probably know the answer, but I don't. Why is it that if the N95 masks are superior, then why in the ORs, why are surgical masks, where you would think the gold standard would be when people in surgery are in surgery, why aren't they used in surgery? And if a surgical mask is considered good enough for the OR, then why isn't it considered good enough for the general public with the virus? Does anybody?
We're also getting into a little terminology to here with there, because there is a surgical N95 mask, and then there's also what we've been calling the surgical mask, which is the
Right.
3-ply or 5-ply, the paper ones that are different. So I'm not sure. I mean, part of the reason that we're not encouraging everybody, to do N95s all the time, as opposed to, to the exclusion of everything else, is the supply chain issues that David alluded to, in terms of why I think, David, you worded the letter the way that you did.
Yeah, so Bob,
So the reason-
do you have any I'm sorry, somebody else.
I was about to say it's mostly because we know that COVID is transmitted aerosolized
Right.
and not just droplet. And so, I mean, if they're doing an operation on somebody who has TB or COVID, yes, they would be wearing an N95. But the main point of surgical masks in a general, surgery atmosphere is basically for prevention of any contact infection. essentially.
Droplets, fomites, and
Yeah,
bacteria,
droplet,
more
yep.
than aerosolized.
And they're also testing.
And the other thing is that you probably wouldn't need masks at all if you had the kind of ventilation, negative pressure updraft ventilation with HEPA filtering and a UV kill zone. You probably wouldn't need to wear masks at all. It's a pretty effective way to keep the air clean. But I don't have anything. I don't have anything more to offer you on that one. Bob, do you have anything on that?
I would say that most physicians in the operating room wear an N95 mask, especially on our team where we do aerosol generating procedures. So I do require anybody on my staff and all of my residents to wear N95s. Some of the other cases, I don't know, like general surgery cases, if they're wearing N95s, but I would say probably 80 to 90% of the surgeons and residents at Jefferson do wear N95 masks in the OR.
Pre-pandemic.
Say that one more time.
Pre-pandemic?
No, right now, like during the pandemic.
Yeah, no, I was just referring to pre-pandemic, that if the N95 is the gold standard and the most risky point of contact is in the OR just in general, pandemic notwithstanding, then why hasn't that been used all along? And why, if a surgical mask, a regular surgical mask, non-N95 is okay for surgery, why is it then not considered okay to prevent virus transmission? And keeping in mind that aerosolization of a virus is droplets that are aerosolized.
So I would just say that if there was a patient with suspected TB, you would definitely be wearing an N95 mask. But for other patients that didn't have a virus or were not a known virus that could be transmitted, that the surgical masks were used pre-pandemic.
Okay.
All right, so thanks. And I'll get that out tomorrow. And there were a couple of new business items that came up in the course. Is there any other new business to be brought to the table at this point? Is there
Any public?
any
Answer that. Any public? Yeah.
participation? If silence confers negative to both of those, then may I have, thank you, everybody. Another cram-packed agenda. Everybody brought great stuff to the table. Thank you. May I have a motion to adjourn?
I'll motion to adjourn.
A second?
Second.
Meeting is adjourned. Thank you. And we'll be communicating over the airwaves. So thank you very much.
Hey, David, are we the 21st next